You know, it gives the uninitiated a lot to think about, and I hope that the people listening realize that we're supposed to be one of the most wonderful countries on earth, which we are, but our health habits are lousy.
They are. You know, when you consider that the health of this nation is about 28 to 30 in rank among the modern world, and we've got the most modern medical equipment that there is and surgeries and everything, but the biggest problem is our diet and people becoming obese and the health problems that it leads to.
Yeah, it is hard to believe that it can be such a wonderful country, and it definitely is. But they must be paying attention to everything but what they should. And the general population isn't thinking either.
No, and they're just bombarded with television messages daily to the contrary.
I won't say a thing against television. Do you go to are you permitted to go to schools and give talks about mouth health?
Most schools have nothing prohibiting it.
Do they encourage it?
Not that I'm aware of in this area. Some areas they may. We've had a few teachers that have requested. Well, they used to request that they come to the office with their classes, but with the expenses of school districts today, they're cutting expenses wherever they can, so they don't bring kids to the office anymore. Sometimes we get an invite to the school to talk to the kids. You know, this is something that our office enjoys doing, is getting out and talking to the schools, and you know, whenever I have a health fair that I can go to, I try to get to it.
Because it's something for me to think about too, because actually you have to go back to the beginning of life and work up from that.
It's much easier to get kids healthy and then keep them healthy than to correct things
when
they get older.
And the food industry will hate me for this.
But schools are starting to get the message there, and they're starting to do things.
Well, maybe about 50 years from now. I won't be around, but if it helps kids in the future, it's worth it. Very definitely. I think I've taken so much of your time today, I'm ashamed of myself for taking so long. But will you come back again, please?
Oh, it's a pleasure. I'd love to.
Well, we've had Dr. James Donley and used his time up, and he may have used his time up, but look at what we have learned. And we're going to let him go for the day, and we're going to come back and see you, and we're going to bring this doctor with us.